Have you seen that video with the little boy who's talking to his mom? And he says, "Listen, Linda, listen." Yeah, we think it's a little bit funny, a little bit cute, a little irreverent, but we get a laugh out of it. Well, guess what? As a parent, I'm sure mom was having some interesting thoughts in her mind. As a caregiver mom, I know mom had some interesting thoughts in her mind. Now, as a physician caregiver of my patients, I also have some interesting thoughts when my patients don't listen to me. So, we're going to talk today about why you should listen to your doctor. Welcome back to our channel where we talk about all things depression and depression related disorders. And we're talking today about why you should listen to your doctor to have better outcomes. So, your doctor is a key player in your healthcare journey. And that's mainly the reason why I think you should pay attention to their recommendations. I won't say advice because I don't give advice anymore. I only give recommendations. And what we do is we lay out options for our patients, and then we allow our patients to choose what's going to work best for them. So, when we're speaking, we're hoping that as we're listening to you, you're listening to us and considering following our recommendations. So, here are a few reasons why you probably should do that. Reason number one, expert knowledge. Now, I know Dr. Google knows all things, and I know we can get information from all other kinds of places. But I had a person recently who said, you know what? Street knowledge is good and stuff on the internet is fine, but I need to know that I'm getting the real information from somebody that actually knows what they're talking about. That's the reason that you listen to a doctor, number one, is the expertise that they have. Believe it or not, I did not get my MD out of a Cracker Jack box. Like other physicians, I spent years in training, becoming a medical professional. And the doctors that are likely in your lives have all done the same. They usually do possess an in-depth knowledge about the human body, how it works normally, and diseases that happen where it's not working normally. So trusting their expertise can help you make an informed decision about your overall health because they've learned how to think in terms of symptoms and systems, not just the one or two things that you might put into a Google search to see what works. Reason number two is that holistic assessment. Now, doctors, again, they consider the entire well being. Again, they're thinking from a systems approach, not just isolated symptoms. They take into account your medical history, the information that you're telling them in the consult that you have, your lifestyle, and other factors that may be impacting your health. As psychiatrists, I was trained, and several of my colleagues were trained with the biopsychosocial model. I use the biopsychosocial spiritual model. I'm using each of those different areas to help me make an informed decision about number three, diagnosis and treatment. Now, doctors are actually trained to diagnose and treat a variety of medical conditions. Now, we at Live Life like to listen without labels. I'm not going to put a label on everything, right? And labels are just that. It's a common knowledge so that we all know what we're talking about. But we're using our expertise, the medical tests, diagnostic tools, and assessments, sometimes imaging studies, to help us identify the root cause of your symptoms. When patients come in and they see us on their first visit, one of the things we do is we go through a little mini presentation. We talk about the root cause of illness because lots of times people are dealing with the surface root causes. They're not dealing with the deeper root causes. And those deeper root causes, talk about that in another video, but the deeper root causes are really the reason that most people come and see a provider. Which brings us to reason number four, preventative care. Doctors play a crucial role in preventative medicine. We talk about things that you could do. An ounce of prevention is worth a pound of cure, right? Things that you can do to prevent certain things from happening. Obviously, things like vaccines and screenings and lifestyle modification can help prevent illnesses, but we take on those things and also help use them to treat illnesses. And we have this thing called primary, secondary, and tertiary prevention. Primary is we don't even want it to be an issue at all. But secondary and tertiary are basically kind of minimizing some of the consequences that you might have if you've already started down one path or started to have some difficulties. That preventative line of thinking that providers have, that's going to do you some good. And again, that might not come through on your average Dr. Google search. Which is reason number five, trust and partnership. Dr. Google is nobody's partner. Sorry, but he's not your individual provider or she's not your individual provider. And a provider that knows you, knows your family, knows things about you, they earn your trust and they enter into a partnership with you. Again, at our practice, it's collaborative relationship. We lay out options to you based on the information that you share with us. And then we're making a collective decision following recommendations and guidelines that come from evidence-based medicine to help you have an improved well-being. Now, remember, your doctor is a valuable ally on your journey to better health. Now, I'm not saying that doctors know it all, but they know a lot. They've got expertise and they can give you the ability to empower yourself to make informed decisions and achieve optimal well-being. So, moral of the story is listen to your doctor, social media family. They actually are one of your greatest assets. They're here to guide you every step of the way. And speaking of guidance, here at Let Life, we offer mental health guidance one step at a time. And if you're in the DMV and you want to work with us, reach out to one of the numbers that's listed below in the byline, or give us a call at 507-533-LED-LIFE. Again, 507-533-LED-LIFE. I'm Dr. Bergina, and I hope that you have a very blessed day on purpose.